Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. I have started a series of the role plays for doctors and nurses, and today's topic is for the doctors. It's a medicine topic. Setting is suburban general practice. Now let's start with the task. Doctors, as you have the setting that is suburban general practice, you have the option to start with the task by welcoming the patient. Hello, my name is Dr. So-and-so, and I am the doctor in charge in this suburban general practice, or I'm your attending doctor today. How may I help you? Now the patient will start that I'm a parent of 10-month-old boy, and doctor, just check my child. He's continuously passing stools, and I feel that he'll be losing his water, that is dehydration. Sometimes the patient may not be able to express the ideas by using the particular medical term. You may use, and one thing very important, doctors, do not use the medical terminology to much extent. It is to minimize use and so that the patient should be able to understand. Consider that the person sitting in front of you is a layman, does not know much about the medical terminology, and it is advisable to reduce it as much as you can. If you're using something, then you have to elaborate it or you have to explain it in the simple language so that the patient should be able to understand that. Now let's start. The mother is saying that my child is passing stools continuously. Then you have to ask that for how long. The patient will say that for the last 24 hours. And here, which is the most important question to be asked is, how many stools the child has passed till now? Mother is quite anxious and she's feeling that the child is in the serious condition. Whereas you have noticed that child is playing on the ground and he's healthy, as is mentioned in the case notes. Then you have to convince the patient that first of all, relax. You are in your child is safe and the best treatment will be provided to you. So try not to worry. I'm here to examine your child and I can see the child is playing and there is nothing to be considered serious. So can you please tell me the consistency of the stools, whether these are the hard stools or these are the loose stools, is a watery stool or it is somewhat thin, semi-solid. The patient may say that it is semi-solid, not very loose, not very hard. And the most important question to be asked, whether the stool is that indicates that the child has infection. If the stool is infectious, child has infection, in that case, stool might be foul smelling. After getting this information, you have to tell the mother that one thing important which I left. Ask the mother about her name. How would you like to be addressed? And as it seems to be a young mother, you may call the mother by the name. Let it be the mother says, my name is Sophia. Then you have to start telling that, Sophia, I can see that your child is not in a serious condition because he is playful and playing on the floor. And see, he's not even crying at this time. And I have examined your child, or you may pretend that you are examining the child. Take one pause of few seconds. Then you should tell that I've examined your child, and I don't think that there is nothing to be alarmed about. This is quite common condition in this age of the children when they are at the dentition, or it might be the child if he has some problem with the dentition. In that case, he has this problem of having crying spells or passing stools. But mother is continuously saying that my child is serious as he has passed 10 to 12 stools in the last 24 hours. You may ask that, has he gone with any episode of vomiting? The patient may say that 1 or 2 episodes of vomiting. Even this is not to be considered serious because you have seen that the skin is not dehydrated, skin is properly hydrated, and the child is cheerful, and there are no signs or symptoms of considering the child to be in a serious condition or dehydrated or infected seriously. You should convince a mother that, Sophia, I am not in a mood or don't feel that the child should be prescribed any antibiotics or any medicine at this time, because I can feel that the child is in a cheerful mood, he is healthy, and he will get this problem relieved by its own. The only thing you have to consider is to provide him proper hydration first, and secondly, keep on giving him properly. As in this case, it's not mentioned that whether the child is on, yes, it is continue breastfeeding more frequently. Up to 1 year or 10 months, children, they are taking mother feed, but it is not sufficient for the child. Then, but here, to make the child comfortable, you have to tell the mother that, Sophia, give him mother feed more frequently, as a child will feel more comfortable in the lap of the mother and while taking breastfeed. Along with that, the doctor, you have to suggest the patient to give him gastrolyte or any saline glucose solution to make the child hydrated. In this case, it is more important to convince the patient rather than giving solutions to the problem, because solution is not big, but the mother is more anxious, mother is apprehensive towards her child, and the main task of the doctor is to convince the mother by telling her the condition of the child and not preferring any medicine to be started at this time. At the end, you may end up by saying the topic that, Sophia, I'm giving you a pamphlet which has the complete information regarding do's and don'ts. Do's means you have to give her saline water or gastrolyte frequently. Secondly, give him your feed also. And thirdly, keep a eye on your child, or keep a check on your child. If he passes more stools and these are more watery stool with the foul smell, in that case, there is an emergency number written on the pamphlet. You can contact it as that number. Secondly, one thing very important to be considered, that is, if the child feels feverish or you find that the temperature of the child's body that goes higher, in that case also you can contact us. But if the child is in the similar condition, or the consistency of the stool is not getting harder for 2 to 3 days, it is not to be taken seriously. If the child is taking feed properly and he's not crying a lot and he's not having fever or any other problem, in that case, these type of the episodes, these type of problems, they are subsided by its own only by monitoring the children, because this is quite common condition in the case of infants at the age of uh, 8 to 12 months. In this way, you can end up the topic. And now, one thing very important, when you're convincing the patient or the mother of the child, in that case, use the polite language. Suppose the patient is anxious and he uses some odd language, don't get panic. You have to be very sophisticated being a doctor. Keep your politeness, and keep your politeness at this continued for the long time. Don't be short tempered. Sometimes the patient may start using some but we can harsh language, the rude, become rude to you, but you have to be very polite and humble in that case. This is the demand of the role play. Hope this topic will be helpful for you. If you like the task, do not forget to like and share our video. And if you have not subscribed our channel yet, subscribe it right now so that you should get the information of the latest updates on our channel. We are trying to upload a few videos every week and at least one video per day. which is going to help OET aspirants who are going to appear in the test very soon. As I'm finding that many of the students, they are stuck at the speaking only at 320 or 340, which is very painful. And if you're playing your task properly, definitely you will be getting 400 plus. And my preparation for my students whom I'm teaching, they're getting 420, 450, even for like that also. So if you're using all these tips in your task, definitely you will be crossing 400 in your OET role play. Thanks for watching. Stay connected. Happy learning. And if you want any other special video to be made, must write me in the comment box. I'll reply you and try to make that video for you. Thanks for watching.